We have really had a rich day today, and I just want to, we'll have 30 minutes here for wrap-up comments. I will do some, but I also will turn the mic over to you in the audience, roundtable members and others, to share your reflections for today. Anything that's been mentioned today already will end up in the final report, but if there's something that you want to highlight, reinforce, add to, something that you think was missed, this is your opportunity, because only what was said and discussed here at the meeting today will end up in the final proceedings. Just so you know that the materials, slides, and videos will be on our website within a couple of days, so anything that you think you missed, you'll be able to go and find, and then the proceedings will be out in the months to come. So if you have any questions, certainly email the staff, and I want to use this opportunity just to thank our roundtable staff for what they've contributed, Kamani Hamilton Way, Carla Alvarado, and Alina Bachu. Please join me in thanking them. They, along with the planning committee, and I would just tell you, if you want to look at your agenda for the day and the workshop objectives, the planning committee, in my opinion, just hit this out of the ballpark as far as making certain that we address these objectives today. So just thank you again to the planning committee that Dr. Sharsing mentioned this morning. So as we think about what we've heard today, I jotted down some of the things that really struck me. And one was that we need to change our mindsets in health and healthcare, that educational outcomes are health outcomes. Is that getting our mind around that? And this whole thing that was talked about was just mentioned in this last panel, that we're not fixing the child, that we're not fixing the family, but we're meeting their needs. And in doing so, we're going to get to the outcomes that we want. And this whole hearing Oregon talk about, essentially they got out of their own swim lane about making certain that they were meeting the family and child's needs. And that was foremost, not, oh, is that my role? Is that my job? No, it's like we're meeting the family's needs, getting out of their swim lane. And then this whole concept of synergy of interventions, I guess I knew that, but I hadn't really thought about it, that breakfast in schools, yes, I thought about it as nourishment, but it's also about that child getting connected and feeling like they care about me because they're meeting my need that I have for breakfast, and that's going to help me perform better. They're not thinking that, but it will help them perform better, and that there's probably a greater chance that they won't be dropping out because they've had breakfast and they felt like they're cared for and they're connected. So that synergy of interventions that happen within the educational system that helps them stay in school. And then this whole concept of speaking in a language that educators speak, and that the concept of what was recommended about having colleges of education and schools of public health and medicine collaborate and talk together and learn a common language together can help in this collaboration that we want to see happen. And this, we've talked a lot about chronic absenteeism, and again, it was just a concept I hadn't thought about. You know, you just, as a doctor, I think about, oh, well, a day here or a day there, 3 days out for asthma here. But when it starts adding up to 10% of the days that child was supposed to be in school, that's chronic absenteeism and the impact that has on outcomes. And that this, coming back to the metrics of a child thriving, that chronic absenteeism as being an important metric. And then this, someone said that it's complicated to interpret the behavior of kids who are in front of you. And just this thing about our whole concept of thinking we can fix the child without having the humility to realize that it's maybe a vision problem or breakfast or bullying in school and no connectedness, and that it could be the mental and behavioral health of their parents, going beyond even thinking about just the child that seems complicated in front of you. And then the shared outcomes being the fifth vital sign. I really like that concept. But if the measures don't really relate to education, that they see that they're important to their attainment, same thing's going to be true for health care. So how do we make that fifth vital sign be mutual and be shared and be something we both care about? And then it reminds this last thing, Matt Stiefel asking us, do we have the right measures? We have some good, sounds like we have some good things, but do we have something that we've talked about at the roundtable before, life-ready 18-year-olds? Have we got the right set of measures, both in health and education, that will have life-ready 18-year-olds, which is what's been said, the #1 product of our country, or life-ready 18-year-olds. So then this concept, just want to reiterate the concept of the whole child, whole school, whole community approach. We must address the entire child. And then last, what was said about storytelling. We've heard that before at the round table, just to reiterate the importance that people learn through storytelling. That's what hits people's hearts. But we shouldn't tell stories without data, and we shouldn't tell data without stories. And what was said was, the more we tell stories, we can amplify the benefits, and we can change the culture in our country. And I would say, based on some of what we just heard, the stories should include the disparities, and the data should include the disparities and how we need to build towards equity. And then the last thing I would share, because when I was Commissioner of Health, I had a really good public health lawyer. And I would say that committed public health lawyers can be your friends. So with that, those are some of my reflections for the day. And we've already heard some in our last comments here of other reflections that people have already had. But I would just invite you, we have 20 minutes or so here, for people to share their reflections of the day, and particularly things that you want to emphasize or add to make certain they end up in our final proceedings. So please come to the microphone.
Okay. So I would just like to leave the day talking about the metrics. Thank you. So it can be confusing what the metrics should be, but in my mind, some of them are very clear. For example, I think we should be measuring the number and rate of elementary and middle school students who need eyeglasses and don't have them. We don't know that now. I think we should be measuring the number and rate of children with asthma who are out of control and are getting care in emergency rooms and are not taking efficacious medications. And I think we should be attempting to measure and close the gap between Hispanic and African American children in that regard. I think we should be setting as a metric changing the rate of non-marital teen births and reducing the double gap between white females and African American and Hispanic females. I think we should be using as a metric the amount of bullying and the amount of fighting that goes on in schools throughout America, and the number of children who are missing school because they're afraid to be at school or travel to or from school, and close the gap there. I think we should be trying hard to reduce the amount of hunger and food insecurity in children, and that should be one of our metrics. We should be trying to increase participation in the school breakfast program, which is about half the participation in the school lunch program. We should be trying innovative strategies to help children with attention and hyperactivity issues find ways to succeed academically and socially. And we should find ways to take care of children that have untreated oral health problems. Accomplishing each one of those things is not that easy. But right now, there are proven or promising approaches that have already done that. So I think our challenge is to see how well we can put those ideas into practice. And then focusing on the issue that was raised about not just looking at the outcomes, we should also be looking at the way students feel about going to school and measuring the climate in schools. And there can be other metrics, I'm sure, that would be very useful, but I think those things would be a really powerful start.
Hi, I'm Linh Tufte, State Health Officer from North Dakota and also Population Health Roundtable member. Thank you to everyone that presented today. The material was awesome, and to the organizers for the meeting. I just wanted to have on the record that I'd like to see us educate both providers, healthcare providers, as well as our educators around early brain development. We had a little bit today, but not enough. The science is developing more, and how kids, before they even get to school, their brains have been their brains have been impacted in such a way, whether it be in the womb or in the home, and that's all something that we're still learning about. Teachers, they don't know either. So I'd like to have that be more prevalent and available. And so, great job today. Thank you.
I'm Jennifer Dillahay with the Arkansas Department of Health. I was really pleased with the ideas and the broad range of topics covered today, a lot of innovation, good information. One area that I'm more interested in learning about that wasn't covered well today, was alluded to, was the impact of alcohol and marijuana use. I know we have a very pro-addictive culture in our country. There's a lot of political will dealing with opioid, but alcohol and marijuana are so much bigger than that. And I would hope that perhaps we can begin to incorporate discussion, and because this is not just the students, this is the families also, the whole envelope. This envelops all of these students in so many ways that it's so much part of our culture that we have difficulty seeing the impact. So that's my thought. Thank you.
Kathy Bazzi from the Michigan Health Improvement Alliance and a member of the Roundtable. I also want to applaud the Planning Committee and all the speakers. This was a really outstanding session today. And although in the work of the Roundtable over the last 5 years or so, we've talked about all the factors that and tried to recognize all those things that do impact population health, and we've certainly recognized health before, but this was a nice deep dive, deeper than we've had in some ways, to bring some of those things to the fore. And the models that were shared illustrating the links between health and education at the beginning sessions were really helpful. But I remember thinking also that they brought the context to that because there was poverty on the model as well. So here's the education and here's health, and they affect each other, and the arrows are going both ways. But there were things below that that are affecting both and that are affecting the entirety. And so while I've been reflecting on the richness of today, also reflecting on the totality of everything that is in the context that's still affecting that, in that health and education are not isolated entities that are affecting each other. In our last session on policy, there's a lot of other policies besides education policy that are affecting both health and education. Our immigration policy, the requirements for work, for benefits, and how all of those policies are going to impact both health education in addition to the call out of poverty, which was on the graphics that were shared. So there's the bigger picture still surrounding that, but I did appreciate the shining the bright light on just these two elements today.
Sally Kraft from Dartmouth Hitchcock, and I have just learned an enormous amount. And I have a daughter who's a teacher too, so special place in my heart for teachers. One of the things I just today was reviewing our recent community health needs assessment that we completed, and nowhere on that community health needs assessment are there any survey questions about education in the schools as a health issue. So I'm thinking from the health system perspective, how do we incorporate education as part of our community health needs assessment? And then how do we make wise investments with community benefit dollars to try to promote this relationship between health and education? And I think there's an opportunity. I certainly would appreciate learning how to make the assessment and how to make those investments wisely.
So Gary Gunderson, I'm a roundtable member and vice president of Faith Health at Wake Forest Baptist Medical Center. So you sparked me. I wasn't even sure where to respond to such an extraordinary feast of, for what were new thoughts. And frankly, I'm a little embarrassed that a lot of what I heard today were new thoughts, that I should have known every bit of this. But I will pick up, a very practical step I took today was to email our director of public health and my counterpart at our competing hospital in Winston saying, I think we found the clue as to what we could do as grown-ups to give the next generation a chance, is to drop our competitive behavior and our siloed behavior at least around the kids. And I think I want to appreciate every single person who was involved in this day for sort of sharpening the moral quandary of what it means to be a grown-up right now, is to at least do what we can for the kids. And you mapped out so many practical first steps. So in many parts, there are things we don't know about. You mapped a lot of stuff that actually is very clearly aligned, even legal best practice. So thank you.
Walking to Mile Middle School Kindness Challenge. I have one more challenge for the group, and I'm so glad that we had this meeting because it focused on a particular set of issues that ESSA has brought up for the first time at the federal level, and that's the absolute primacy of strengthening the conditions for student learning. And so that's, I think, what we've been talking about all day long, strengthening those essential conditions for student learning. We talked a lot about context and all the drivers of that context. One thing that we didn't talk about, and I'm so glad that Cam brought up the science of learning and development, is the key, the importance of human relationships to learning. That was something that didn't get a whole lot of attention, and what we know from the science of learning and development is that human relationships are key drivers of a positive and healthy development of our kids. If you're familiar with the Gallup student poll released, or the most recent one released last year, only 39% of our K-12 students surveyed, and it's over 1 million students surveyed, 39% self-reported that they believe most adults in their school care about them. That means 60% of students in this country believe that most adults in their schools do not care about them. That's a crisis, in my opinion. That's a crisis of a lack of relationships between students and also among students and adults. And so I would challenge this group to think maybe in future proceedings how we're addressing the nature of relationships in our schools, how we're identifying that, how we're measuring that, how we're building that in a way that is meaningful. Because at the end of the day, that's what educators are doing every single day with their kids. They're building those relationships. And so we need to provide them with the practical knowledge and research and tools to do that more effectively.
Hi, Bobby Milstein, a member of the Roundtable and from Ripple Foundation and Rethink Health. One of the sort of most striking areas of health science that's come up lately is around the role of loneliness and social isolation, and the converse benefits of a sense of belonging and civic agency, even sort of the civic muscle that is immediately helpful to people. It makes them feel good. But it's also a pragmatic necessity to do anything to shape a common world, to pass policy, and you know, the message that I got from today is just how powerfully the school as an institution is sort of one of the first and most consistent things that people, you know, feel. Like, I mean, obviously you feel like you're part of a family, but the ways in which you can shape your family are obviously pretty complicated. How do we learn how to work together through a sense of belonging and the idea that students can have a meaningful role in shaping that school culture? We touched on it today, but I think this is you know, the health science would suggest that that's a pretty powerful avenue to use the schools as a venue to cultivate these critical sense of belonging and you know, that we can be shapers of a common world. So I'll stop there. Thanks.
Mary Pittman from the Public Health Institute and a member of the Roundtable. I was sitting back there thinking, what can I say? This was such a rich day, and it filled me with joy to be part of this roundtable, because I really felt like we were addressing something that was not only meaningful and important for us to discuss, but something that really is setting the stage for the future of our country. If we don't get this right, if we don't address these issues, our kids are not going to be able to have the opportunity that they need, and our country is dependent upon that next generation of leaders. And when your comments, Bobby, reminded me that we have a program called Faces for the Future, and I see Kimmy nodding. This is a wonderful program that takes young people who are in some disadvantaged situation and helps them have a mentor and people who care and people who help them see hope for their future. And they take young people who are not the smartest, or by our measures of what's smart, that is the test scores. They take young people with a 1.8 GPA, and they help them see a future and provide them with a mentor, with support, and a way that they can build their own future. And what we found is that these young people, the majority expected to drop out, we have a 100% graduation rate. So if you think about giving up on those who are measured by their test scores and their GPA, and then you see these young people who with support not only graduate, but they go on, the majority of them, to get a higher ed degree, but not only that, their health status improves. And not only their health status, but their families do better. So if we wonder if there's a connection between having a caring adult, between having a system that helps you see that you can overcome barriers with supportive environments, and if we don't see that connection between health and education, we're probably not looking at the right metrics. Thank you.
Thanks. I have a very a profound note to read. We have 3 minutes to leave the room. Okay. Is that good? Got it. Okay. But I also get to wrap things up here and just say that we have a very well-funded health system in this country. We have huge educational needs that matter so much for health. And I think this was just a great session to talk about the ways that health can really deliver for the educational system. And I have met many, many dedicated people in the health system who really have no idea how the kids around them are doing in school. And if we can bridge that gap, it opens up all of these different paths to helping them. And I think we took a step towards that today. So please, I want to thank the California Endowment. Again, I want to thank Kimani Hamilton-Ray and Alina and Carla and everybody who put this together, and especially all of you for coming and watching. Thank you.